Hey, this is Russ. I recently received a message from one of my viewers, and I can't recall whether it's a male or female, but I'm just going to say she, all right? And she mentioned that she couldn't lift her leg after surgery, and she was having panic attacks because she knows that she's going to have to go into an MUA. So she wanted to know how I was able to get through all this. All right, so I wanted to address this on a video rather than writing it out to her. Okay, so let me first say this: I had problems lifting my leg too right after my surgery. Okay, so that could be some type of muscle atrophy, but I know atrophy usually happens from not using your limbs, okay, for a while. So the question is why did it happen so quickly? I mean, right after surgery, I literally could not lift my leg. All right. Now, I'm not a doctor or a physical therapist, so I can't really tell you why this happens, but I can tell you that it happened to me. All right. So you're not alone. Okay. So I would sit on a chair, and I have a recliner chair, and so my leg is kind of extended, right, as I'm sitting, and so if the physical therapist, I had an in-home physical therapist for the first week, if he said lift your leg, it wasn't even moving. It's like I'm thinking move my leg and nothing moves. Okay, and I think this is probably what she has as well. So if I'm just sitting, of course, I can't bend my knee at that point either. I can't lift it. If I'm laying down, I can't lift it. It's literally not moving. Okay, so I'm thinking there's got to be some type of miscommunication through nerves or something like that's not allowing you to move your leg. I mean, your brain is thinking it, but your leg isn't moving it. All right. Or it could be muscle atrophy, where through trauma, something happening like a surgery is causing your leg not to function like it normally would. Okay, so let me first address this issue. All right, I don't recall how long it took me before I could actually lift my leg. It could have been several weeks to a month before I could lift it a little. I mean, I could walk on it if somebody helped me up and said, okay, you gotta go walk, or you gotta go walk to the washroom or something like that. I could kind of walk on it, but I couldn't bend it, and I definitely could not lift it on my own. So let me first address your issue here by saying that you're not alone. This is not just you. Okay, happened to me too. Now, obviously today I can do quite a bit of stuff. I can lift my leg no problem. I've done this before in other videos where I'll just lean back here. I'll just lift my leg up. So it's not like I can't do it. I can do that today. All right. I couldn't do that when I first got out of surgery. So you're not alone. Don't worry too much about that, because I think in time with physical therapy and work, that will come back to you. Okay. It could have taken a couple of months, really, before I started be able to use my leg a little bit where I can actually move it. So don't worry too much about that. Now, she also mentions about, how did I deal with all this MUA stuff, and how did I handle all of this? Well, I think I've mentioned before in the past on other videos, and if you haven't watched my other videos, I'm talking directly now to you, right? If you hadn't watched the other videos, go back and watch the other videos. Start from the beginning. There's a playlist. If you go to the Russ is Right channel, there's a playlist of knee replacement videos. Start from the beginning and start watching some. Okay, you don't have to go through 100 and something videos, but I think from the beginning, and if you watch, let me say at least maybe the first 10 or 15 videos, okay, it'll give you an idea how I was handling things and how I was doing it. You can see that I wasn't doing very well. I mean, I'm still upbeat as I usually am, but I couldn't move my leg either. Okay, so how did I handle it? Well, first off, you have to have faith that you're going to be able to do it. Okay, and you can't give up. You all know that. That's what I always say. You can't give up. I had mentioned in the past that I have a fairly high tolerance for pain. Okay, I don't know where that came from. Maybe it's just from punishment of martial arts or something. I don't know. That's what messed up my knee in the first place, okay, from the Taekwondo, a lot of kicking. And I can handle quite a bit of pain. Now, the knee pain has always been more than I can handle. It is the one type of pain that, I thought I was going to be able to handle. I couldn't handle it either, right? And was I scared? Yeah, I was scared just like everybody else is scared, and when they were mentioning about going through an MUA the very first time I went through it, I could just imagine things in my mind that, if it hurts this much from them trying to push me, how bad is it going to be when the doctor's pushing it really hard, okay? But let me assure you that it's more in our mind, in our brain, than it is actually going to hurt you. Because when you're actually in the operating room, they're going to knock you out. You're not going to be awake, okay? And they'll probably put a nerve block or something in your legs so that you can't feel it. So just like when you went in for your operation, okay, you probably didn't remember anything until the time you woke up, right? That's exactly what's going to happen at the MUA. You're not going to know anything, right? You're not going to feel it either because you're out, okay? Now, when you do wake up, I have mentioned in my other videos that you do feel some pain. Yeah, you do. And it's in different areas too. It's not just the knee pain from the surgery. You're going to feel pain, at least for me, in my quad muscles, right? And that's because the doctor's, grabbing you and pushing you hard and bending and everything like that to force any type of scar tissue or whatever is holding you back to move, right? So he's kind of stressing out the muscles a little bit there. So you're going to have that pain, all right? But believe me, that pain, even though it hurts, is not as bad as you think it's going to be, all right? And that pain for me usually lasted about a week and a half because I had 2 MUAs. Now, let me address another thing too. People have continually asked me about, the doctor telling me to do a second MUA. No, the doctor never told me to do a second MUA. I told the doctor I wanted a second MUA, and he agreed that that might be a good course of action, all right? Because after the first MUA, I was able to get some more range. Now, he was able to push me. I started in the 70-degree ranges, okay? And that's when we knew that I had to do the MUA first time through. And he was able to get 130 degrees of flexion and 0 degrees of extension while he was in the operating room. Okay, I'm going to show this photo. I've showed this so many times. It's the only photo I have from the operation, from the MUA. Okay, and same thing during the second MUA. He was able to get 130 and 0. But after the first MUA, when I got out of there, I didn't get 130 once I woke up. All right, I was in the 90s, somewhere in that range. Okay. And then after the second MUA, a month after the first MUA, which was a month after the operation. So operation, 1 month later, MUA, another month later, another MUA. Okay, so I started at 70, went in for the MUA. I got out of there, I was in the 90s. Okay, then I went back in for a second MUA. He got 130. When I got out of there, I was in the low 100s. All right, so you're not going to get immediately the range that he's able to get, because he's doing it while you're knocked out, all right? But by the time you wake up and your knee is hurting and your quad muscles are hurting, you're not going to get that full range because your pain is going to hold you back. So you have to continue working in physical therapy to try to get the range back. And eventually, I was able to get 130 degrees when pushed hard by my PT, all right? And so on my own, I was getting, I should look up these things before I actually do these videos. I believe I was getting around the 114 ranges or something like that, maybe. Maybe it was a little bit less than that, but I was able to pull back on my own by that much. So today, I am able to get 120 degrees on my own, okay? And I'm fine with that. I don't need to be at 130. I'm happy at 120, all right? If I can get a little bit more, I will. And I'm still working on it, all right? This has been 16 and a half months now. I'm still working on my knee, trying to get more range of motion. And let me say this too, and I don't know if I've mentioned this at all in the past. Even though I can walk now and things without a cane, I still use the cane. All right. Around the house, I try my best not to walk with it, but when I'm outside, a lot of times you'll see me with the cane just in case. All right. I don't want to fall over or anything like that. But I can feel every step that I take. I'm still stiff every single day. If I'm trying to do heel slides, many of you know what a heel slide is. If you're laying down on your back and then you just pull your leg back and slide it, up on the bed. My leg is pretty stiff. My knee is pretty stiff, and I can actually not hear it, but feel it have like a little click, a little bit of resistance. Man, I talked about my trigger finger problem. It's kind of like that with the knee. I get to a certain point, I can kind of feel it kind of click a little bit and pull in, and it's stiff and it doesn't move very easily. All right, so I have that ongoing as well. I don't have the strength in my knee that many of you might already have, after a couple of months. So how do I handle it? Okay, that's the original question. You have to have faith that you're going to be able to do it. Whether you can or not is another story, but you got to have faith that you can do it and just keep trying, okay? I handle pain because I do have a fairly high tolerance for pain, just not the kind of knee pain that happens right after surgery, okay? I can't handle that just like everyone else can't handle it. And as far as the mental part of it, I have the fear too. I was very scared going into that first MUA, but I will tell you, going into the second MUA, I didn't fear anything because I knew exactly what was going to happen, and I knew that I wasn't going to feel anything going into it the next time. So really, I think this whole thing with the MUA is more in your mind than in reality of what actually happens. But will you have pain? Yes, you will after the MUA. All right, you're going to have it in a different area. For me, it was on my quad muscles, the upper thigh. Okay, that got pushed so hard that it kind of like hurt that. And so even in physical therapy, as I'm moving around and stuff, I felt the quad muscle pain more than the knee pain sometimes. But it only lasted about a week and a half. Was it worth it? Yes, I would say it was worth it, because that week and a half of pain gave me the ranges that I needed to move forward. And I think truly without that MUA or the 2 MUAs, I wouldn't be where I am now. Okay, that was necessary. I also give credit to the physical therapist for pushing me. Now, I know a lot of us don't like being pushed, and she mentions the same thing too, that it really freaks her out. Yeah, I was the same way. I was scared too going into this. And every time the PT comes, I'm a little nervous about it, okay? Going into physical therapy, I'm joking with everybody, but in the back of my mind, I knew what was going to happen, that he was going to push me. And whenever that time came, he would say, "Russ, are you ready?" I'd have to go into a different mental state, all right? And I mentioned this before. Here's how I typically did it. I would take a breath and exhale, take another breath, and then let him push, all right? So here's how I did it. And maybe you can try this mental exercise too. So he'd ask me if I was ready to go. He wouldn't just start in on me, okay? He said, "You ready?" And I'll say, "Okay, hold on." And I'll do this. Okay, all right. So I take that second breath, and then as he pushes in, I would breathe out, okay? And am I screaming? Absolutely. Top of my lungs screaming, okay? And I found that screaming allowed me to handle more of that pushing, all right? It's the same thing, like I said, in martial arts. When we punch and we kick, we kind of scream as we do it because it gives us more power to do it. And don't be afraid to scream if you have to, okay? Because I know a lot of people, because I've seen other physical therapy people too. They'll hold back. They'll just go, "Ow, ow, ow, ow," okay? If you got to scream, go ahead and scream. That's what I'm saying, all right? I don't care what the people around me think, because it's my physical therapy time too, and I needed that screaming in order for me to withstand the pain that he was giving me, okay? And I don't care who else was around me, okay? I was having more pain than anybody else in that room, believe me. Okay. Now there's other physical therapy guys in there for knee replacements too. I mean, there was guys doing shoulders and all sorts of stuff. I know they have pain, but come on, the knee pain is pretty intense. All right. Scream it if you have to. Don't fear it. Okay. Just go through it, because if you don't keep pushing at it, you're not going to get the range that you need. Okay. So addressing directly to you who wrote to me, all right, I understand what you're saying. I understand that you're saying that, you're afraid of it and everything. Don't be afraid of it. You have to go through it if you want to be able to walk and be able to use your leg again, okay? Allow the physical therapy to push, but put some boundaries. Just tell them before you do it, give me a little time, let me get myself in a mental state, and then let them do it. That might help you a little bit. Anyways, if this has been helpful for you, go ahead and hit that subscribe button, hit the like button if you haven't already done so, and I will talk to you guys next time. Good luck.